The portion of the Medicare laws that governs prescription drug plans is called Medicare Part D. Here are a few things you need to know about it.
So the first thing people need to understand is this is insurance.
It's the biggest change in Medicare since the federal health insurance program started back in 1965. Medicare Part D is prescription drug coverage aimed at helping people with Medicare. But unlike the original Medicare program, the drug benefit is offered through private insurance plans that will be reimbursed by the federal government.
I don't take that much medication, so that's what I'm saying.
But for some seniors, like Peggy Ann Bailey, the enormous amount of plan choices is simply overwhelming. That's when people like Pat Venable step in to help maneuver through the maze.
First and second page of this will tell you a summary about what Medicare D is about.
Pat is a coordinator with the State Health Insurance Assistance Program, or SHIP, a national program that offers help to people with Medicare to understand and enroll in a drug plan.
It is confusing, and Medicare has worked very hard through the SHIP counselors, through 1-800-MEDICARE, through advertising opportunities to help people understand.
That's why 66-year-old Peggy Ann has come to this free Medicare seminar at her local senior center, doing her homework on what will be the best plan to ensure her health.
You got a choice between all these plans, and it's so difficult to find out which one that is good for yourself, okay?
In 2007, it may be even more confusing. More plans and more providers. 17 companies are approved to offer Medicare drug coverage nationally. In 2006, there were only 9. As a result, in 2007, every state but Alaska and Hawaii will have more than 50 drug plans, with 23 of those states offering at least 55 plans. Compare that to 2006, when most states offered a mere 40 Medicare prescription drug plans.
The research is important.
In 2007, there are not only more plans, but less time to pick and choose. Beginning November 15th, seniors have until the end of the year to enroll in a drug plan or switch to a new one. In 2006, they had about 6 months to enroll. So be warned, if you are 65 and older, you don't have what's called creditable coverage, meaning insurance equal to Medicare Part D, you didn't sign up in 2006, and you missed this year's enrollment deadline, you will be penalized a lifelong increased premium of 1% for every month you waited to enroll. So, if you were eligible in 2006 and did not join a plan or have creditable coverage and missed open enrollment for 2007, you could be facing a lifelong penalty totaling 19% of the average monthly premium each month. Currently, the average monthly premium is $24, so a 19% penalty would raise it another $4.56 to $28.56 per month. And even if you chose a plan last year, you should carefully review your options this year.
Don't assume that the plan you were in last year is the best plan this year. They have changed.
I don't have so much money left in my Medicare, so how can I pay $93?
If you think you can't afford a Part D plan, or if you're already having trouble paying for your drugs, take advantage of programs that are available to help you. Based on your income and assets, you may be eligible for help. For more information, call Social Security at 1-800-772-1213 or apply online at www.socialsecurity.gov. Next, find out what kind of health care coverage you have now and whether you have any prescription drug coverage. Begin making a list of the drugs you regularly take, including their names and your dosage, how much it costs each time you refill that prescription, and how many times a year you refill it. You'll need this list to help compare plans.
You can call 1-800-MEDICARE, and they also are equipped to take a list of your drugs, put them into the program, and find out which program is the best program for you.
You can also find information about the Part D plans available in your area at the Medicare website, www.medicare.gov. Once you have information about the plans available to you, start comparing. You'll want to look at the monthly premium, the deductible, what percentage you pay for coinsurance, and what amount your copayments cost. You also want to compare the list of covered drugs, called a formulary, and check to see where the plan's network pharmacies are located. And finally, check to see if you are currently enrolled in a plan that offers coverage equal to a Part D plan. Again, that's called creditable coverage. If you have it, you'll save yourself a late enrollment fee if you move to a Part D plan later on.
So I challenge you tonight to go home and sign up for mymedicare.gov. It is a website for you to get your own personal information.
Welcome back, ladies. You know, the big question is always, why is it so complicated to sign up for Medicare Part D?
You know, it's really not as complicated as a lot of people have made it out to be. When you think about the insurance, the health insurance that all of us have in the employer market, where our employers provide insurance options for us, this is really very much the same thing that people are now in Medicare able to take advantage of. What we're looking at is a first-year transition, and indeed, it's a huge program. Medicare has not had a change of this nature since it was created in the mid-1960s. We have a benefit in place that's now providing somewhere between $1,000 to $1,200 a year on average to Medicare beneficiaries. That didn't exist before. But in order to do that and do that right, and also ensure that Medicare beneficiaries would have some choices so that you wouldn't just have one benefit and everybody would have to go into that single idea, that there would be some options just like we tend to have in the employer market.
Amy, talking about options, does every senior have to sign up for Medicare Part D?
No, Medicare Part D is an optional program, so they can choose whether they want to. Tricia mentioned that some people who are already in an employer plan that's as good as Medicare's may not want to take Medicare Part D at this point. But most people, even if they don't have a lot of prescription drug costs right now, will eventually. So it's a good idea to get a prescription drug plan for kind of peace of mind in the future, too.
Now, I understand that there are two types of this plan. One is the standard Medicare plan, right, and the other one is Advantage plan. Can you distinguish between the two for us, please?
Sure. Medicare prescription drug plans, standalone plans, are what most people who are in what we call original Medicare. So they have Medicare Part A, Medicare Part B, and then they might have a Medicare supplement policy or Medigap paying after when they go to the doctor. Right. And now they add on a standalone Medicare prescription drug plan to cover their drugs. And then the other option that you mentioned is Medicare Advantage plans, which are like Medicare HMOs and Medicare PPOs, which are basically private companies, and a person's going to get all their Medicare benefits, their Medicare hospital, their doctor visits, and their drug coverage, all from that same company.
Is Medicare Part D expensive to sign up for?
Not generally for people. It costs a little bit of money in premiums or coinsurance for most plans. But when you think about what you're getting from the government and what this benefit now provides, it's certainly a good move for almost every beneficiary, unless, as we've talked about, you have your employer-based insurance. You can get a very low, either a zero or a very low premium plan.
The average is $25.
The average, the national average is $25, but or roughly $25. But in most communities you can find plans that cost less than that, and it really depends on what your needs are. For instance, Alex, if you are a consumer who has very few drug costs, let's say you're incredibly healthy and you're still running marathons and you only have maybe one drug that you're taking on a regular basis, and that's not that expensive. It probably is a wise idea for you to pick a plan that has a low premium and that's only going to charge you, you know how much your cost sharing or your copay is going to be each time you need to get that drug filled. So that's probably, you pick a low premium plan and something where you've got a predictable, but it may be a slightly higher cost sharing. But if you're someone who has 5 or 10 drugs that you need to get, and those drugs are pretty expensive, it's probably to your advantage to find a plan that has a slightly higher premium, so you have a stable monthly payment that you're paying in premium. And then you find also a plan that's going to give you your drugs with lower copays. So that's, it's a balance.
Right.
And then that's what Congress has constructed here, is something that lets people figure out what their needs are.